Hi, my name is Dr. Erin with the Rejuvenate Life app, rejuvenate-life.com. It's important what you do with your dash. If you see me using lots of hand gestures, but only one hand, it's just because I had shoulder surgery recently on the other side, and so it's not quite up to snuff with everything. But I'm going to be doing a series of kind of going through in my book, Healing Through the Storm, How to Restore Health While Life is Happening. I'm going to go through some major life events that happened to me that I talk about, or at least give like a little overview of it. So first one is just when I was born. So obviously I don't remember this. We don't really have active memories until we're about 3 years old. But for me, my mom, I was due December 8th, and my mom was at a Christmas party a couple days earlier than that, and was dancing to Beach Boys, of course, because she loved Beach Boys. And she wound up going into labor just a little bit early with all of the dancing. So anyway, I was born, but I had the umbilical cord wrapped around my neck twice. So how does this possibly relate to chiropractic? Well, I could have had quite a bit of neck trauma at that point from the delivery. I was blue. I needed oxygen. My brother thought he got a Smurf. So I was perpetually a disappointment because he thought he got Smurfette, and instead he got a sister whose first sentence strung was telling on him that he was jumping on the bed. So, he was perpetually disappointed. Anyhow, so what I want to talk about in general with this is birth trauma. So birth trauma from mom or birth trauma from baby is a thing. Now, Dr. Abraham Taubin has done a lot of research on what happens, how much pulling force OBGYNs use when they're pulling a baby out. Usually 90 to 120 pounds of pressure is, pretty normal if they're going to pull on the baby. Now, with the cord around my neck, if they were pulling, that could have gotten worse. If somebody's head is like twisted around the other way and they're pulling on it, because I've watched a video of that too. Ooh, not good. Now, the bones can actually stretch about an inch in the baby, when the spinal cord should only stretch about 1/4 of an inch. So we can have a lot of spinal cord trauma at birth. Now, the research that Dr. Taubin was doing was talking about how much post babies that didn't make it, how much pressure they could pull on a baby's head without it decapitating. And it was really only between 120 and 140 pounds of pressure, a non-living baby, that they could be decapitated. So upper cervical trauma can be very common. For my son, it was his little hips would get off, he would get constipated, and he would just be unsettled. For my daughter, she had jaundice. We adjusted the area of the spine that goes to the liver. She also had a belly blanket. She cleared up lickety split within a day of getting the adjustment and getting the belly blanket. Anyhow, birth trauma is a thing. Birth trauma for me was a thing, considering you have an APGAR score, we call it. And so 10 is a good APGAR score. I don't know what mine was, but not breathing and needing oxygen right away, I was pretty low. So I started off coming into this world with some trauma. And those of you who know that I have healed through the storm, right? There's more, and you'll be hearing me in the series that I'm doing, talking about all these little things. So, just some things to take away from this. If you are a mom, if you have a baby, it's a good thing to get checked, because you never know kind of the trauma that can take place. A lot of kids who have upper neck issues will have ear infection issues. I had those. My sister had those. So much my sister did that she wound up with speech therapy because she couldn't hear for so long. So a lot of times it's the alignment. Babies that get fussy, that get colicky, sometimes it's the food. Again, chiropractors are great at, helping find that kind of stuff out. So lots of things can happen. I have watched babies that can't stand or can't turn their head or get a flat spot on the side of their head, etc., just because their neck is not neurologically moving, brain not communicating to the neck as well. So again, I'm Dr. Erin with the Rejuvenate Life app, rejuvenate-life.com. It's important what you do with your dash.